So we hosted the workshop this morning, which was set up with a number of different work streams. One of which was service improvement and sort of the business modelling sort of side of it. So out of those discussions, I think one of the main things that sort of came through was about the amount of variation there is across the profession in terms of the way that pharmacist independent prescribers are working. So that goes from, how they're seeing the patients. Are they assessing them, physically assessing them? Are they in an office somewhere just generating the prescriptions and the doctors do the rest? So there was a lot of different models that people were using. And also what type of patients people were seeing. Were they just seeing the stable patients? Were they also seeing the complex patients? What types of treatment were they using? So there's a huge amount of variation across the system. And I think part of the support that BOPA can provide is maybe making recommendations as to how we can standardise where appropriate. I think there's always going to be a need for a degree of sort of bespoke services, according to what the local need is. But if we can sort of reduce unwarranted variation across the profession, then I think that's a good thing. We also talked about the training of pharmacist independent prescribers, and I think again that contributes to this variation that I spoke about. Some pharmacists have physical assessment skills and they're qualified to assess patients. Some aren't, but there's no standardised training that pharmacists are required beyond the prescribing qualification. So I think that again is something that we could probably make recommendations about. And depending on what people are providing, what people are prescribing, they may need to assess patients and they may not. So I think it's not going to be one size fits all. I think there's things that need to be considered before those sorts of recommendations are made. So that's something that was useful that came out of the workshop. I think one of the other real problems that people have is actually how we model the staffing arrangements for pharmacist prescribers. At the moment, there's a lack of investment in pharmacists as prescribers. So a lot of the pharmacists are actually prescribing in addition to their sort of traditional pharmacy roles, and so that really puts a strain on the workforce and the resilience of the service that you can provide. So for example, if a pharmacist is off for illness or leave, then there's real problems in working out how that gap is filled, whether that comes from the medical team or does pharmacy provide that backfill. And if pharmacy is to provide that backfill, have we got the appropriately trained people to do that? So you then move into sort of workforce planning, and there's only so much you can do at a local level, but I think another role of BOPA is going to be to apply pressure so that there is pressure for departments to be able to invest in pharmacist prescribing specifically, and it not just be an add-on to their normal roles.